Super utilizers are, are celebrity clients. I guess those are the celebrity clients, right? That we could say we're
Yes.
helping. They're pretty well known to our partners and their departments of health. And, the way that we think about this is that it's almost like a Rubik's Cube to solve for. And there's a way to solve it, right? And it's just about understanding what are the complexities with that particular super user. We had one in, again, this is example in Florida, where it was a patient, fairly young gentleman, who had a lot of, let's say, conditions that he was managing. And he had over 200 transports the prior year. We were able to get him down to under 10. And the very next year, and that was not just a telehealth call, as much as I love telehealth. It was not just telehealth call. We coordinated their Department of Health. He was on their top 10 list. We were able to get him enrolled in some programs. He, in particular, had passion for streaking and losing his medication because he would take off his pants and
Yeah.
his bottle would be in his back pocket and he would lose it. And so when we dug deeper, right, into solving this Rubik's Cube, one of the things that he said was that he had to go to the hospital to get his medications. And I think that this is something that's really important when it comes to super users is really paying attention to what they say in detail. For us, when he said he had to go, that meant we wanted to clarify, what do you mean when you say you have to go? And he explained, I have to go up there. That's where I get my medications. And it turns out that is what he had to do. He was
Right.
right. The pharmacy, because of his passion for streaking, he would lose his meds. That would be a 30-day prescription and he couldn't get a refill. And so what they were doing was they were actually rationing his prescription. They would give him a couple of pills at a time. So he had to go to the hospital to get his next, dose and script filled. And this was such an epiphany
Right.
because when we called the pharmacy, they were fairly insistent on continuing to ration out his pills. And we said, do you realize he's had over 200 transports? And part of it is he's
Right.
coming up for that. They hadn't realized that. I don't know how they thought he was getting up there, right? But they hadn't realized that our doctors were able to talk to them, get it changed to CVS. We signed him up for like the CVS Care card thing and prescription delivery to his home, to his mom's home, where his mother was able to get his prescription. And I mean, that changed quite a bit when it came to his equation, right? And his quality of life.
Right.
And we got a lanyard with a little pill bottle in there so he could put his pills around his neck, still streak all he likes, right?
Yes.
We embrace patient behavior if that's what he needs to do. But how do we make sure he doesn't lose his pills? So that was pretty impactful, him being able to still have his pills by wearing it on a lanyard around his neck. But I think that when it comes to super users, it's often listening and being creative in finding a solution that fits for them in their world with their logic, with their preferences. It can't be, this is not how you should do it. You should do it this way. There's not as much success with, trying to reason and change the behavior there. So it really has to be around making this work in the way that suits them. And that's where you can be really effective with super users. And our team has a lot of time, right, to do that. There's no way that our partner would have had the time to do all of those things because they are saving lives. And so, we have that passion around that piece as well. And that's how we think about super users is, okay, how do we solve for what it is that they need in the way that they need it?